So the Journal of American Medical Association received those emails. Here is one by Gregory A. Pullen, an MD, who is a Mayo Vaccine Research Group. He is at the Mayo Clinic in Rochester, Minnesota, and at the Division of General Internal Medicine, Mayo Clinic, Rochester, Minnesota again. So before we start into this article in the Journal of American Medical Association, this man basically states that vocal vaccine deniers, and I'm sure that he would consider myself to be one of those. He states that we refuse to have public discussion, a civil public discussion in regards to this matter. And so I invite him. Mr. Pullen, if you ever watch this video, and I have an email, in fact, that I'll be sending at the very end of this short Facebook or long Facebook Live video, requesting a civil discussion, public discussion, regarding the safety of vaccines and the legitimacy of the science that we have, and why people like myself are so avid vaccine deniers or skeptics or whatever you want to call us. But I feel like, first off, whenever you read a research study or an article, always read who the person is, get to know the person. Conflicts of interest and disclosures. Dr. Pullen reported receiving grants from the National Institute of Health and being the chair of Safety Evaluation Committee for novel investigational vaccine trials being conducted by Merck, manufacturer of our current MMR vaccine, and several others. Research laboratories. Dr. Pullen reported providing consultative advice on vaccine development to Merck and Company, Avianex, Adjuvants, Valneva, I don't know who Valneva, I haven't heard of them yet, Medicago, Sanofi Pasteur, GlaxoSmithKline, Emergent Biosolutions, and Dynavax. So these are the companies and individuals. So obviously his conflicts of interest, and being a outspoken proponent of vaccinations, he has major conflicts of interest. That's without a shadow of doubt. He makes money off of the sale of vaccines. I do not make money off of the convincing of people not to vaccinate. In fact, I've said many times, I help a lot of people who have been shunned, shut out, and treatment has been refused by the medical community, those who promote and provide vaccines and profit off of vaccines, after families are told that they will no longer be seen if they don't continue to vaccinate their child, in which the parent feels that the child was injured by vaccines. They're shoved out by the medical community. They oftentimes do seek my care. So in essence, you could say that my conflict of interest is by speaking out against vaccines, I attract those individuals. So there's my declaration of conflicts of interest for myself. But I do not make money off of what I'm doing here really today. At best, I would probably make more money in all reality if I was to just talk about health conditions, asthma, eczema, allergies, different illnesses, whether it be autism or ADHD, neurocognitive, behavioral problems. If I would just talk about autoimmune conditions and how we know that the natural alternative, they say they're alternative, they should be mainstream, but anyways, that is what I sell, that's what I do. I consult people, I coach people on natural methods to get well, get healthy. We identify underlying causes. So I could just talk about those conditions, never mention vaccines in a negative light, and I guarantee you I would make more money doing that. So really, I hope people can take that in consideration when really trying to accuse me or accuse anybody that speaks against vaccines as being money driven. So here we have preserving civility in vaccine policy discourse, a way forward. The reason I feel this article was written is because here lately, because of the denial of public discussion, we look at Ohio right now. Ohio, during their financial bill, whatever bill they have for the budget, politicians tried to sneak in a portion of that bill, a clause or whatever you want to call it, in the bill. This is why Ohio is meeting right now. You have Robert F. Kennedy Jr., Bobby Kennedy up there, you have Jack Knight. You have a lot of great people who are speaking out against vaccines and bringing the science, bringing the research there, but having to do it outside the true public arena, not doing it within the meeting rooms with our politicians, and simply because they're trying to sneak the portion of the bill to remove religious exemptions in Ohio. So you wonder why. I would ask Gregory Poland, you wonder why so many parents, mothers, fathers, individuals who are skeptical of vaccines or deny vaccines or would never accept a vaccine or really feel that vaccines are massively harming our children and causing greater harm than benefit. You wonder why so many of them are now being driven. They're being driven to emotional reactions when the public politicians, our politicians or Congress members, aren't listening to them. Take, for instance, you get a few seconds to speak, and I think it was well over 600 individuals met in California when they were having a hearing on SB 276, and over 600 individuals showed up to request that they deny this bill, that they refuse to pass this bill. And this bill was to restrict a medical physician's, a person's medical physicians from writing a medical exemption. So it's really a draconian, anyways, a law that restricts and removes so many rights from people. And it's sad. They were given a few seconds. They couldn't talk about science. All they could say is your name, your profession, and whether you were for or against the bill. And despite the massive majority, over 10 times more people being there in opposition to that bill, the bill still passed. And you wonder why parents were crying in the hallways. They're crying in the hallways because they weren't listened to. Their concerns weren't heard. The bill was passed when the evidence was in opposition to what was happening. So we're going to go through this. You can see the screen in front of me. My staff will put it up on there as I'm reading through it, hopefully. So vaccine policy making, meetings, advisory committees, and legislative hearings at the local, state, and national levels have become increasingly uncivil. Many who object to vaccines have resorted to shouting, threats, and other disruptive behaviors. These behaviors erode the premise of civil society. They go on here, civil skepticism in public discussions about vaccine policy can lead to productive discussion. If we can have civil discussions, we can lead to productive discussions. And that's what I would invite Gregory Poland to have with me. Again, I will email him personally. His contact information is in this article, and I will request that he have a civil public discussion with me in regards. And I would see and treat him as the expert only to bring the science and the information that I have personally read myself, which is well over 1,000 documents in the peer-reviewed medical literature, that's brought me to the decision and stance that I truly, beyond question, the evidence that vaccines are safe and effective, that claim that vaccines are safe and effective. So I'm requesting that public discussion. And I'll do it civilly. I actually can do that. I know that a lot of people may be surprised. Vaccinology has uncertainties, so the science has uncertainties, and that's a major problem. Goes on, good science is the foundation of good policy. Science is complex, the evidence is sometimes conflicting. But the denial of conflicting evidence, let's take for instance the evidence that showed that the vaccination, the flu vaccine, let's take, and I don't get the opportunity, I won't have the opportunity, I know that I've discussed this topic in the past. If you go through my website and you view the videos and you search it, there has been evidence conducted and published in peer-reviewed journals, conducted and funded, I believe, by the CDC, if I'm not mistaken there. Don't quote me if I am wrong, and I apologize if I am. But they found a significant increase in autism in children who were born to mothers who selected to be vaccinated with the influenza vaccine, specifically during the first trimester, which stood out compared to the second and third. So that being said, that science should at least, since it's the only study ever been done to that detailed degree, that is the best available science we have. That shows and says, or even the science that has shown that spontaneous abortion So the loss of an infant, loss of an unborn child was seen, a significant rise, again, I think primarily during the first trimester. So when you look at these scientific studies, that is the best available evidence we have that has ever been conducted in that population at that time of pregnancy, and we see harms such as autism. We see increased association with stillbirth, or spontaneous abortion or autism. You know what? If that's the best available evidence, then why don't we play it safe? Why don't we stop vaccinating at least that category, or those mothers that are still in the first trimester? But science discredits it. They simply brush it aside, and that brings more skepticism, and should, to everyone out there. If they'll see harms being done, or the association of harms in their own research that was looking for to see if there was harms being done, and they discredit it, they brush it aside, they don't do anything about it, they say keep vaccinating despite this information, how are we not going to become more skeptical? So it says absolute certainty is elusive. Transparent presentation of the science is imperative to sustain public confidence, requiring open discussion of how best to balance protection of public health with individual freedoms. So transparent presentation, I think, is probably one of the most crucial things we could talk about. When the CDC won't be transparent, I know the majority of you know, the link isn't in there, Rachel or Ashley may be able to get it in there, but the C-SPAN, if you just Google this, you will find it. C-SPAN, S-P-A-N, all right, C-SPAN, Representative Posey, CDC whistleblower. If you search that, you will be able to find a 5-minute clip of congressional video of Posey, a representative of Florida, who spoke and requested that Congress subpoena and investigate the claims and confession of fraud, where a senior scientist, the CDC, came forward and confessed to committing fraud, that he and his colleagues, his co-authors, they destroyed data. So when Gregory Poland is asking and stating that transparent presentation of the science is imperative to sustain public confidence, then I would ask Mr. Poland, Dr. Poland, to actually demand that the Congress subpoena William Thompson. And I know Representative Posey is not a senator, he's a representative. Sorry for that mistake. But that is the problem. The CDC is unwilling to be transparent with their information. In fact, when they find evidence of harm, of something so catastrophic, a catastrophic issue, both on a public scale and a personal scale, which is autism, which is vaccine injury-induced autism. That right there, they wish to destroy the data. They attempted to hide that association. They committed research fraud. So they weren't transparent. And again, this is one of the major reasons. The fact that the medical community and the public health professionals, health departments, our Congress members are unwilling to be transparent with information, have a public hearing and investigation, and subpoena Dr. William Thompson, put him on the stand publicly to answer why he would come forward and confess to committing fraud. That would be true transparency. But it seems nobody in the medical community wants to demand for that, except for what I believe Gregory Poland refers to as vocal vaccine deniers. So going on here, most people, Ashley, you able to take care of that? Most people still support immunizations, but a vocal and disruptive group of vaccine skeptics have adopted uncivil tactics, thereby disrupting and bypassing the healthy, transparent debate and democratic procedure of the U.S. vaccine policy. Again, I'll refer back to Ohio. You look at Congress members. I believe Ashley linked to it, but I have a video there for you. If you TWD in the comments, I have a video of when I was allowed, see the author, or the, not necessarily the author, but it was a Tennessee Congress member, a gentleman who brought a bill to the floor, or a resolution to the floor, to allow the Tennessee Public Health Department to put out information that would be handed out in public schools that would go home with students to advise and encourage the flu vaccine. So in this video, you would see that the discussion wasn't much of a discussion because sadly, we were each given a few minutes. I was given 5 minutes. There was no time limit that I could see given to the public health physician, the medical physician who was selected to come up there, who brought no science whatsoever to the table, to the discussion. He simply brought the same old mantra, the same old statement of vaccines are safe and effective, they've saved thousands of lives, this is a good resolution, we should advise children to get the flu vaccine. Whatever he said, I forget, but that is it. There was zero scientific evidence brought to the table, brought to that discussion. Instead, to our state level committee, I read through multiple peer-reviewed New England Journal of Medicine, Journal of American Medical Association, I read through Journal of Vaccine, I read through the Cochrane database of systematic reviews, reading directly from the peer-reviewed medical literature, stating none of my opinions, simply reading the available evidence, which showed that the data, the science has been manipulated, that the conclusions state that there is no benefit in vaccinating our children against influenza. And in fact, both in human and animal trials, if you search on my website for flu vaccines, you will get tons and tons of peer-reviewed medical literature studies in the references of each one of the videos that I've done in the past. But when I told them that there has been scientifically validated both in animal and human trials that when we inject our children with the influenza vaccine, we actually disrupt natural immunity. We disrupt what is considered or called heterosyptypic immunity. Heterosyptopic, heterosyptypic, kind of the same things, two different interchangeable terms. In the scientific literature, you would find that by vaccinating a child, we actually circumvent, we destroy, we can alter, we can harm their natural ability to fight off future infections with influenza. And that's what the recent CDC-funded study showed, that children who get the influenza vaccine are no less likely to get influenza, but actually more likely to catch other influenza-like illnesses, to become sick with other bacteria and viruses. Thus, there's a that is evidence of detrimental effect. And that's a study done and published in 2018. That wasn't even available to me when I spoke to our Congress members here in Tennessee. But as you would see, I told them exactly what was going to happen and has come to fruition. I literally would have to say that as a Christian, I prophesied. It was not a prophecy that I wished to make, but it was what I told them. The evidence shows us by vaccinating our children, we are putting them at greater risk of the very thing we wish to protect them from, which is severe illness and death. And what did we see in the following seasons? We saw higher numbers of children dying from influenza. We saw epidemic proportions. The very next season, they had to shut down schools, something I had never seen in my entire life before, because of the number of children missing school because of influenza and illness. So we see the result of promoting what happened after the promotion. We saw more children die. They disregarded the science, and at the next hearing, they tabled it, that hearing. They tabled it, they didn't vote on it. So I returned and I missed work that day, going down because I felt that the fact that I brought the science in which the medical physician brought no science, I felt that they would respect the fact that I had done my homework, that I brought the science. I figured our congressional members would be respectful of the science that was brought to the table, the evidence that showed harm. The next meeting, the next Wednesday, they voted, but they voted after only allowing the Tennessee Public Health Department to walk up there, give no scientific evidence for benefit, to simply repeat the same old thing that vaccines are safe and effective. And then when given the opportunity, the chairman of that committee offered it to the rest of the committee, does anyone else have someone they would like to speak? And I literally sat there. I would like to speak, but I can't speak. I can't be given the microphone. I wasn't given the opportunity for civil discussion on a congressional level, whatever you want to call it, I wasn't given that opportunity, even though I was the only one who brought science to the table. No one offered. One woman said, I won't vote on it because the health department hasn't brought me the information I'm voting on. So I can't vote on something I've never seen. Thank God for her. I wish she would have voted against it, but everybody else voted in favor, and as a result, more children have died. So vaccines and skepticism. A range of vaccine skepticism exists. From a small percentage who reject all vaccines, I reject all vaccines. And I'll be completely honest, if Gregory Poland, MD, this medical physician at Mayo Clinic, wishes to engage in a civil discussion, I admit fully that I am one of those people that will never allow my children to be injected with a vaccine. They would have to do long and hard work, do actual scientific research, and I know that he would feel that what I just said is actual scientific research. He would feel, in which he requests that people like myself give ideas or recommendations on how to acquire the actual science, and I will in a second. We reject all science. I do not reject the science. In fact, I'm one of the few people, the few parents in this world. I mean, I would put it to him and say, how many peer-reviewed medical journals can you bring to the table that you have read, that you can verify that you fully read? Each one, cover to cover, evaluated, cross-referenced, read their references upon references, and we'll see who has read more science in regards to vaccinations. Or if he can find any other parent that has decided to vaccinate their children, yet has read more research than I would gladly have a public discussion on that. And I would be civil throughout the entire process. Because I'm not against individuals, I'm against the idea, I'm against people who lie, who do not fully disclose. Like he said, transparent presentation of the full science, the full information. I am completely for that. That's what I want. That's what I'm attempting to do. But when I see health departments make false and non-scientifically valid statements about the ability of certain vaccines, like the whooping cough vaccine, to be able to protect the public, in which the science shows that there was an increase in infant mortality, infant deaths, following the recommendation that all children and all individuals be vaccinated against whooping cough. That's in the peer-reviewed medical literature, and I've read that study, that we know that the vaccinated spread whooping cough more than the unvaccinated, that the vaccinated people have an immune response which is mismatched to that acquired by natural infection. Thus, the vaccinated population are the ones spreading the illness to the most susceptible. So when the health department on a Christian radio station wants to claim that you can get the whooping cough vaccine and protect yourself and others, that lie emotionally drives anger in me, because I completely disagree with lying to people. So it is not the science I reject, it is vaccines because of the science. I reject vaccines because of the science. I do not reject science. Says they reject all vaccines and science as a way of knowing truth. To those who are misinformed or have misperceptions based on incomplete science. So this is the type of skeptic. He is those who are misinformed or have misperceptions based on incomplete science. The incomplete science is coming because even our government committees. I did a video recently, Ashley may know about it. I did a video recently calling out a newscaster, a female, who was basically going about saying that vaccines and adverse events, a government study, a government document that was over 800 pages long, and I've read a lot of it. I will admit I haven't read all 800 pages, but I have read over 240 pages, all of a government document that says the available science to say vaccines are safe and effective is fragmentary. This is a quote. It's fragmentary and inconclusive on many issues. So the incomplete science is coming from the scientific community. But yet the scientific community is trying to say that vaccines are always safe, always effective, cause little to no harm, or when they do cause harm, it's so small that the benefits far outweigh the risks. Yet this 800-page document reviewing the available evidence, discrediting, even they would discredit using sorry about that, folks. Somebody was calling me. They discredit their own tracking system. So government researchers threw out science that showed an association, showed a statistically significant association between vaccines and autism. They threw that study out because the data was derived. The data was found derived from VAERS, Vaccine Adverse Events Reporting System. So a government reporting system, government scientists, when that science says harm is being done to children, they throw it out. So why are we even having a vaccine adverse events reporting system? Why is the government even paying somebody to take and report or keep track of these reports that are completely voluntary, significantly underreported, but then they discredit it and say that because it's voluntary, it can't be accurate, and we won't use it as evidence of harm. They discredit evidence of harm by saying, it's insane, it's sad. But in that, they said over, I believe it was roughly 135, don't quote me on the exact number, but it was 130 some medical adverse events, serious adverse events, neurological problems, sudden infant death syndrome, and many others. They said what? That they do not have adequate evidence to accept or reject a causal association. So they could not say, no, this autoimmune condition, this demyelinating condition, this serious chronic health condition, this asthma, this eczema, these chronic health, debilitating medical conditions that occur after vaccines, that have been reported after vaccination by parents and medical physicians, we don't have enough scientific evidence to say no, they are not caused by vaccines, but we don't have enough science to say that yes, they are caused by vaccines. So the available scientific evidence leaves it up a 50-50 chance. Like there is, the problem is though, the problem is that medical experts, media will say vaccines are safe and effective. They cause very little harm, but yet the government scientists say 130 sometimes debilitating and deadly side effects, possible side effects of vaccines. We can't say yes, they are caused by, but we cannot scientifically say no, they are not caused by. But people, scientists, medical physicians, vaccine proponents get on national television and say vaccines are safe and effective. They don't have the science to be able to say that. Why don't they just say the truth? Speak the truth. Say, we don't have the available science to say, yes, they are safe and effective. We don't have the available science to say that your child now suffering with a chronic, massively irritating, painful condition like eczema, we don't have the science to say, no, it is not caused by the vaccines. Why don't they admit that? There's skeptics such as those who are hesitant and those who accept vaccines despite lingering doubts. It goes through and it goes on to say vocal vaccine deniers who reject science should propose an approach that is more rigorous than the approach they reject. Okay, this is one of those major statements as if we should be the ones to, so he's basically asking here, somebody like myself, a vaccine denier, somebody who rejects vaccinations, who he's attempting to say we reject science, should propose an approach that is more rigorous than the approach they reject. So he works for Merck. He is consulted with Merck. He, again, this man If you look in the conflicts of interest disclosure, Dr. Pullen, reported providing, being given he's a chair of a safety evaluation committee for the novel investigational vaccines trials being conducted for Merck Research Laboratories. And he's consulted with Merck. So Merck makes Gardasil. Gardasil safety trials were conducted using what they claimed was a placebo. It was an aluminum adjuvant. And there's plenty of scientific evidence to say that aluminum is extremely neurotoxic, that aluminum adjuvants stimulate, that is their purpose, is to stimulate an immune response. There's plenty of science that immune stimulation during infantile and developmental stages can actually cause developmental delays in the brain, and even in scientific studies on the aluminum adjuvants in the hepatitis B vaccine given to infant mice, newborn mice, it causes alterations in the inflammatory pathways in the brain that result in cognitive and structural brain abnormalities later in life. That is the scientific evidence available to us. Merck thought it be a rigorous approach to use an aluminum adjuvant that is not an inert placebo. A placebo in true scientific research, in legitimate scientific research, they would use something like saline, something that is completely harmless. A saline placebo, something completely harmless, inert, having no negative or positive effect on the individual. Truly looking at a completely unvaccinated individual and a vaccinated individual. Merck injected one group with Gardasil and another group with the aluminum adjuvant, and said that was adequate for saying it's safe. So they used something that was known to be harmful and saw a significant number. 2 to 3% of the girls in this trial suffered new onset of chronic autoimmune conditions. That is supposed to be rigorous science, so I would gladly volunteer a better approach. But yet I will say this. Here's where I stand on this. The better approach would be to study vaccines in a randomized controlled trial where you would vaccinate one group of children and give nothing, no other vaccine, no adjuvant, nothing to the other. That would be the most rigorous. Or you would look at populations that were vaccinated versus unvaccinated, in which they have done that, and I did a video on that, and you'll have access if you look through my website and find the video I did on the vaccinated versus unvaccinated children, or vaccinated versus unvaccinated studies. And what did they find? Unvaccinated children are healthier, have less hospital admissions, less emergency department visits, less asthma, less allergies, less autism. Those are rigorous studies. That is the best available evidence that could be made and created. But I will say this. I do not wish to see any more children vaccinated. To prove what the science already shows, when you actually look at the true science, when you look at the available evidence, it is extremely clear that unvaccinated children are far healthier. When you look at the available science, you would understand that the health crisis of measles, polio, the supposed health crisis of these infectious illnesses, you would see that they were already on the decline in mortality and even rates, that the mortality decline had occurred prior to vaccines. And thus we don't have to fear these illnesses if our children were to get them. And again, that's Journal of American Medical Association research that I'm stating from and gathering information from. I never want to see another child harmed. I never want to. Quote me on this, folks. I never want to see a study conducted where it would be a randomized controlled trial where a group of children would be vaccinated and a group of children never vaccinated. The reason I would never want to see that trial is because all it would be doing is proving what the science already shows, that vaccines lead to greater health crisis, chronic illness, and death than being unvaccinated. Folks, I don't want to see any more children harmed so that I can be proven right in that way, because we already have the science. Look at the studies on the DTP vaccine in third world countries. All the available scientific studies ever published on the DTP vaccine show an increase in overall mortality up to 5 to 10 times, specifically in girls. Again, I've done videos on this. I may be stating things that we don't have in the TWD links in the references to this video. I'm asking people to do a little bit of homework in my videos on my website, where you will find not my opinion. You won't be taking my opinion. You won't be taking me as the expert. You will find the studies that I am stating, or I am quoting from, or I am talking about. Increased overall mortality because of side effects that range from neurological problems to immunological problems, thus a greater death rate. He says that people like myself must borrow intellectual capital from scientific method. They're not using the gold standard of scientific methodology in vaccine research. Shoot, the Hep B vaccine. Hepatitis B vaccine has been approved for children on day 1 of birth upon research that wasn't done in infants day 1. It was children up to 10 years of age. And all they followed these children, if you read the vaccine information packet from the manufacturer of that vaccine, you would find, and you can get this off of the FDA website, you would find that they follow these children for 5 days. One of the studies used for science and evidence of safety found that children received 3 shots, 3 injections of the hepatitis B vaccine, only had a slight increase, and I'm literally stating what they said, a slight increase in adverse events compared to children who were given 2 shots. That is beyond unscientific. If someone were to say that you can prove safety of a shotgun by shooting somebody twice versus shooting them 3 times, that is one of the most unscientific things you could ever use to claim safety. But that is what they do in vaccine science. And I just would love to ask any proponent of vaccinations and proponent of the science, advocate of the, quote, science, I would love to ask them how they validate that as evidence for safety. Goes on, lost. I'm going to do this real quick. Yeah. Lost in the disruptive, uncivil behavior are voices of concerned citizens who responsibly participate in public making process. You know, I thank God for so many people out there who have spoken politely, civilly against vaccinations, but I have watched, I shared this on my Facebook page here recently, I watched someone bring science to the table, bring the government's own information, bring FOIA requests, Freedom of Information Act requests that show that the appropriate scientific studies were not done before the MMR vaccine came to market, that they brought scientific evidence and legal documents to politicians' desk showing that Merck had engaged in fraud, and they're now being investigated in a court of law because their own scientists confessed to fraud. But yet our politicians ignored that, ignored it completely. So when we, in a civil manner, bring evidence of illegal criminal activity by the CDC or a government body, like the CDC or the FDA, when we bring illegal criminal legal documents, government documents, when we bring this evidence to the table, it's ignored. And they wonder why, when we are ignored and it results in them passing a bill that with the evidence that was in that person's hand who civilly discussed it with that politician or that committee, when it's ignored, you are leaving us no choice except for civil unrest, uncivil discourse, uncivil response. That's what they're leaving us to. Once all civil discussion is cast aside, the only thing the public has available to them is, first it will be, what is it? First it'll be when you, we won't comply. We will civilly not comply with the laws being passed. But when we are physically forced, we would attempt to go about resisting vaccinations, resisting these laws, not complying with these laws. We would have to try and do it civilly without physical response at first. But if somebody comes at us physically, we are going to be forced to respond physically, possibly even violently. It breaks my heart to even think about that. What do they think they are pushing this nation to? What do they think that you are pushing people to when 600 mothers and fathers state they are against a vaccine bill? A bill in California, very few people stand up and request that bill be passed, and the Congress members pass it. And these are Congress members and authors of this bill are receiving money from the pharmaceutical industry that profits from the sale of these vaccines. I don't get, and the reality is I get it actually. I get it. I get why they're doing this, why they don't listen to so many parents standing up against these draconian bills. There, I got the word. I get it. They're doing it because they're not there for public health purposes. They are there for money. There is no other explanation for it. When they ignore legal documents, illegal criminal activity, when they don't request and demand for full investigation of a CDC scientist who confessed to fraud in regards to a vaccines and autism, I'm sorry, if they don't demand for a full public investigation into that matter prior to passing any bill that would further mandate or even encourage the vaccine that scientist is confessing. He's confessing that vaccine caused autism because that's what the data showed, that the CDC scientist, including himself, attempted to destroy. That was his confession. If politicians won't demand for a full investigation there's no question in my mind what they're about. It is not public health, because a public health advocate would advocate for the public discussion and investigation of someone confessing to destroying data that showed one of the greatest public health epidemics, both financially on a public health level and an individual level, is being caused by vaccines. They would have to demand it if they truly, in their spirit, wanted to do something for the greater good of public health. So it speaks loudly their undesire, the fact that they do not desire to seek the truth in that matter. Principles of pluralism as a way forward. He says, to achieve societal consensus. To achieve societal consensus, discussion must be constructive, science affirming, and honest. Here is a constructive way of thinking. The fact that the Journal of Pediatrics, infectious disease, in 1999, I believe it was, stated, I believe it's zinc, diarrhea, and pneumonia. Zinc, pneumonia, and diarrhea, something like that's the title. All right, if you look that up, I believe it's 1990 or 1999, but they state that it was prior to the modern vaccine and antibiotic era in which we saw the largest decline in infectious disease and infectious disease mortality. That was before vaccines that we saw the decline of these illnesses, the decline of serious responses to these illnesses. One of the most recent articles that I went through here, I think it was last week's video. I went through this study, an article which a Swedish medical physician and scientist stated that the whooping cough, severe illness from whooping cough, had declined so substantially that the rate of vaccine injury was greater, in the scientific evidence, was greater than the rate at the time prior to the vaccine being available. The rate of whooping cough, severe illness, and death was less than what was caused and occurring after vaccination. A constructive tip would be, we know that the decline in morbidity, severe illness, and even death from these infectious illnesses had declined prior to. Here's another one. Why don't we just look at Sweden? Look at Sweden, look at Japan. Two countries that have the lowest vaccination rates and have the lowest number of mandatory vaccines. They vaccinate later in a child's life. They delay vaccines, in essence, when in comparison to the U.S. schedule, yet their infant mortality is far less than our nation's infant mortality. They are achieving something that is far better than what America is achieving with our current vaccine schedule. With their vaccine schedule, they are achieving a lower infant mortality, meaning more of their babies are alive today. More babies will live to their first birthday. Their overall child at chronic health illnesses are far less than the United States. So they are achieving something with a lower mandated or lower suggested. They don't even mandate. They're a lower suggested, encouraged vaccine schedule. They're achieving what we should be searching, what we should be striving to achieve, which is more babies alive and a better overall health of our nation's children and communities. They are achieving it. So why don't we just look at what they're doing and do that? How about that for constructive discussion? If a country can achieve a better health outcomes in their children than we can in the United States, with far less vaccinations, why don't we just do what they're doing? Take notes from them. Start living lifestyles like them. There's constructive discussion. Science affirming and honest. You hit the key word there, honest. Honest. Merck, someone who has paid you for consulting. Now listen, I want to be civil, I want to be respectful. To this medical physician, Gregory Poland, I'm trying with all due respect. When Merck lied about Vioxx, why don't you question their integrity? When Merck created a hit list for medical physicians who were naysayers against their drugs, why didn't you question their integrity? When Merck's own scientists, their own scientists who were doing the research on the MMR mumps portion of that vaccine, when they came forward and alerted to the FDA that they were committing research fraud using animal blood. This is in the Chatham versus Merck. If you just look it up, Chatham versus Merck, CHATOM versus Merck. You will find it on my website, the legal documents. The fact that Merck is delaying court, is stalling in court, delaying so that they can continue to make profits when their own researchers confess to fraud, why aren't you questioning their integrity and their sincerity about wanting to help public health? I just don't fathom how such a dishonest Multiple times Merck has been dishonest about giving us the truth behind their drugs and their vaccines. How in the world can anybody say that we need to have an honest discussion? The reputation, history has shown us that we cannot trust Merck to be honest about the safety of their drugs and their vaccines. That is a fact. Goes on, principal pluralism asserts the following: there is no neutral scientific ground, but the best way of knowing about vaccine risk and benefit is through measurement and scientific method. Then I would ask you use the gold standard scientific methodology, looking at completely unvaccinated children and their health. There was a study I went through recently about asthma and eczema, the MMR vaccine and DTaP. In one of those vaccines, they saw over 14 times the rate of eczema or allergies, eczema or asthma, I mean. You have to go to the study, be able to view it, you can read it yourself. Scientists mention that multiple research studies have found a statistically significant association between eczema, severe skin autoimmune condition, and asthma in the vaccinated. So the vaccinated children had far more of these illnesses, these chronic, oftentimes prolonged, lifelong illnesses, 14 times. Yet they said because vaccinated children probably don't go to their medical physicians often enough to be diagnosed, then we discredit it. They even said their data showed no association, but their data showed a clear association. Their data alluded at least to an association, but the researchers literally say their data showed no association. That is unscientific. They're not using the scientific method to come to their conclusions. They're using their opinion and their theories of why unvaccinated children appear to be healthier. They're using unscientific theories, unsupported theories, unproven theories to say, yep, that data just doesn't show it because it shows it, but it doesn't because vaccinated children don't go to doctors often. I wonder, are so many vaccinated children at home suffering with eczema and allergies and asthma, and parents are just like sitting there saying, suck it up, Bobby, Jimmy, you're going to have to live through this asthma attack because we're not going to the doctors to get you diagnosed with asthma. I just ain't going to have it because I want to hold true that unvaccinated children are healthier. I want to make sure that we keep the illusion alive that unvaccinated children are healthier. So you can't get diagnosed because that would make it look bad. Individuals with different views must be respected. I would completely agree. But the problem is you have people like Doc Vader on your side. You have people on your side who profit, make money off of vaccines, that will turn around and say that people like myself don't deserve a spotlight. We don't deserve that because it's been settled. Science is settled. There's no way vaccines cause harm. Therefore, anyone who wants to speak against vaccines has no place, should be given no respect, no public opportunity for a legitimate discussion. We will not allow them the opportunity of public discussion because then we're giving credibility that there is even an argument. That's what they claim. So I appreciate the fact that Gregory, Mr. Gregory or Dr. Gregory, you are actually saying we should have a civil discussion and that both sides should be respected. So I love the opportunity to have a civil and respectable conversation with you. Civil and responsible dialogue regarding evidence and values in the best way to work through the uncertainties of science and integrate society values. Public health authorities have a responsibility to balance their authority to protect public health and individual freedom protections. Public health authorities, you know what, they should balance, if they want to balance their authority, then when someone confesses of lying about the safety of a vaccine, especially when it's a government committee, a government scientist, the sole purpose of every politician, every single public health authority should be saying, we will stop a vaccine until we know the truth behind the safety of that vaccine. That would be using authority in the right way. The elements of just policy must be central and inviolable. I thought maybe inviolable should mean just the same as our Constitution. We should have inalienable rights to be able to exercise our religious freedoms. To the person, we have constitutional rights that without a shadow of a doubt allow us to stand either on our religious or personal views to say, I will not accept a product made by a pharmaceutical company, that my body is my body. We have constitutional rights that are invaluable or inviolable. Yet, they're being stripped away from us. But yet they really truly can't be. In establishing public health policy, just policy requires the following. Full information, I agree, about a given vaccine and the disease it prevents should be readily accessible. Again, when the CDC attempts to destroy data, they were attempting to make sure that the evidence about that vaccine was not readily accessible. That's what they attempted. And the disease itself, I would completely agree. When they are saying these are deadly conditions, then medical physicians should be all over the media. Given the fact that per year, right now in America, if we just took the side effect of liver failure, liver injury, that more people in America die from liver injury due to Tylenol than were dying due to measles prior to the vaccine being available. If you take the 4 years prior to the vaccine being available for measles, you would see that an average of 400 people per year in America were dying from measles, and that's before the vaccine was available. Taking that number right there, and then just unscientifically assuming that the decline that was occurring would have plateaued and never declined any further. See, it's unscientific to say that the decline of measles mortality or death wouldn't have continued, that we'd still be seeing 400 a day. But let's just, for simple example purposes, the 4 years averaged out before the vaccine for measles was available, 400 children were dying. Today, more people die from Tylenol just from the one side effect of liver failure. So if we were to say that measles is a deadly condition, then we must, on the same grounds, say that Tylenol is deadly. Why isn't the scientific community coming out and screaming that to the same degree? It was an average of 458 according to the FDA's numbers. And that's just one side effect. That doesn't include the negative and detrimental effect on the immune response a person gets when taking Tylenol. Your immune system is weaker. And because of that, many people dying of infectious illnesses are dying not because of the infection, but because of Tylenol, which inhibited a proper immune response. And that's within the scientific evidence. Tylenol is deadlier. Going on, process by which genuine concerns can be raised. I would love Mr. Gregory. And for those of you who are still watching, I just want to kind of jump ahead and then I'll be hitting send, and maybe I'll do it right now. If you can see my screen in front of me, here is the email I have prepared for Dr. Gregory Poland at the Mayo Clinic. And this is my request. Civil discussion regarding vaccinations. I said I just finished reading your JAMA article titled Preserving Civility in Vaccine Policy Discourse. I very much agree with many of the points you make and would be so appreciative if you would be willing to engage in civil discussion regarding vaccine research, science, and public policy. Though I would likely be as you put it. What I did here was I wish to let him know in full disclosure, I am the person you are likely saying would refuse to ever have a public discussion on this matter. Because that's what he claims here in a minute in his article. Though I would likely be, as you put it, a vocal vaccine denier, I wish to engage with you in a transparent and civil discussion regarding this matter. I feel that the reasons there is an increasing number of vaccine skeptics who are becoming uncivil is in fact because of the refusal of those in favor of vaccines to engage them in a full and transparent discussion. When an individual does not feel as though they are truly being listened to and their concerns are sincerely heard, taken into true consideration, truthful consideration, and their questions properly answered, it drives most anyone to uncivil emotional actions. I wish to simply let you know that I am not one who refuses to engage in civil dialogue. Rather, and I quote that because that's directly from his article, rather, I respectfully ask that you engage me in this very discussion. I hope you will not refuse. Sincerely, Dr. Dale Brown. I just sent it. I would like this man, this medical physician, this medical scientist, this chairman of a scientific board for Merck, and a consultant for multiple vaccine manufacturers, I would love to have a public and civil discussion. I can do it, I promise. Process by which genuine concerns can be raised, ensuring all voices are respectfully heard. I would love that opportunity for my voice to be respectfully heard. A small contingent of vocal vaccine deniers is irreconcilable. Such a tongue twister. How did you say it, Anthony? Irreconcilable. Irreconcilable. I want to say irreconcilable. Dead serious, I failed English pretty much in school. Full disclosure, but I can read science. But I was 99.1% in the nation in biological sciences. But I could barely read Cat in the Hat. I was really slow at reading. I'm like, I was petrified. The fact that I read here on video is like way, I have come a long, I was like the kid who would like want to cry in school if I had to be called upon publicly to read in class. I hated it, scared of it. And here I am now. Irreconcilable. Source of dispute and confrontation, and refuses, here it is folks, he says that vaccine deniers like myself refuses to engage in a civil dialogue about the strength of the evidence. I would like to engage in a civil dialogue, Dr. Gregory Poland, a civil dialogue about what I see is gaps in the research or major conflicts of interest, or even further than that, major evidence of illegal and criminal activity by vaccine scientists. I would like to have a civil discussion about those things with you, sir, publicly, as to allow you, who should be the expert, to answer my questions. Answer questions that I believe the vast majority, I'm sure there's a lot of people on here, on this Facebook Live and watching this video in the future, that would have a lot of questions they would like to ask you. And I would gladly take questions if you would. I would take questions from the public and ask you those questions in a public civil arena. Necessary data or alternative values and trade-offs regarding vaccinations. Conflicting values. In this part of the article he says, no one wants to return to epidemics of preventable disease, and yet vaccine refusal has led to the current outbreaks of measles in the United States, Europe, and elsewhere. People always in the scientific community, the promoters of vaccination, say we will return to the days prior to, we'll see polio outbreaks, all this paralysis, all these measles deaths. But yet, we're sitting here, and I linked it for you if you TWD in the comments. You can only do that on Facebook. You cannot put TWD in the comments on YouTube. You have to go to the YouTube description and click on the link to the blog post to my website to get the references and the scientific studies. If you view the scientific studies that I made available to you all, you'll find 2 of them. And these are the 2 scientific studies that I believe, or at least ones that have evidence of this, where you'll see that in I believe it was 1999, the rate of chronic illness in the children of the United States was roughly 12%. I believe it was 12.6%. And when you look at that, and then you combine it with this study right here, and this study was published 2011, the National and State Profile of Leading Health Problems and Healthcare Quality for the U.S. Children and Insurance Disparities. You'll find evidence and information showing that we have seen a massive skyrocketing in the number of people. You combine the 2 research studies there, and you'll see where we can go from 12% to 54% of our children. Over 50% of our children are now suffering with lifelong chronic health conditions. Unacceptable. For that number, for almost 50% of our children, for over 50% of our children in America now suffering with lifelong chronic, oftentimes disabling medical conditions and neurological conditions, it's unacceptable to say that we are winning anything, that we are achieving anything in terms of reducing an epidemic burden of sickness and disease. Our children today would be better off living before vaccines were available if they wanted to avoid chronic, disabling, debilitating, neurological, and autoimmune conditions. Life-altering, oftentimes disabling medical conditions, chronic health conditions. If they wanted to avoid those, they'd be better off living prior to. To derive the full benefit, last paragraph here, to derive the full benefit of increasing understanding of immunology, immunogenetics, I just felt I would want to let Dr. Gregory Pullen know that I'm somebody that is very abreast. I mean, I know the information, I know the research very, very well. I have literally felt the calling on my spirit and heart to do my best, to know the research the best I possibly can, better than most. That way I can engage in a civil conversation. But I'd love the opportunity for somebody to actually engage it. When I tried to engage our public health department here in Clarksville, Tennessee, every request that I gave to our health department director, and Ashley can probably link to it, you'll have to go back and check it again, but if you look at it, I think it was when telling the truth would send you to jail, or you'd go to jail for telling the truth. You'll get PDFs and emails back and forth between me and the public health department director here in Clarksville, Tennessee, or Montgomery County. I engaged in a civil, respectful conversation for as long as I possibly could. But when I could see that every request, every statement he made, that he would get me documentation, that he would get me research, that he would get me evidence, they would get me documents from the Tennessee Health Department, were nothing short of what I see now as a lie, because he never followed through with things he said. If I tell you I'll do something and I don't do it, I'm sorry, I've lied to you. He said he would do something and he never did. I think I counted more than 40 times. There's 30-some to 40-some times he stated he would do something. He stated he would get me something. He stated he would do something for me. But then he never followed through with his word. That drove me to civil unrest. That drove me emotionally, especially when I hear Montgomery County Health Department funded, sponsored advertising of vaccinations on a Christian radio station lie to people. They lied. Because what they said was you could protect the public with the whooping cough vaccine. And I brought the study funded by the FDA to the front door. of our health department, and I requested a meeting with him, but they wouldn't hear it. What do you think people are going to respond when you are lying on a Christian radio station? When you aren't listening to our concerns? When you aren't hearing us out? When you can't answer us and give us the information you say you have to prove that the science is adequate to say it's safe? When you state you know about a senior scientist, the health director of Montgomery County, Joey Smith, stated in a public meeting with me, or in a personal man-to-man meeting, he stated he knew about the CDC whistleblower. He knew that his senior scientist at the CDC confessed to committing fraud. And I asked him, then what are we going to do about this? I wanted to incorporate me and him together fighting for the truth to be told to all the parents. You know what he told me? And I had the audio recorded, but I deleted it because in my spirit at that meeting, I felt that he was truly sincere, that he would want to help people, that he would want to investigate it, that he would want to work together to find a common ground, have a civil conversation about it. I soon found out otherwise, sadly. I wish I would have kept it. But he said to me, it's above my head. He stated that as a public health department director, that it was above his head to do anything about the fact that a senior scientist has confessed to committing fraud. And I said, it's never above your head. It's not above our heads. We can tell the parents. Why not just tell the parents that there's a senior scientist confessing to fraud, and until Congress subpoenas him, has a full investigation into this matter, there is no way we can legitimately say vaccines don't cause autism. So before you accept this vaccine for your child, sir or ma'am, mother or father, you need to know that there are some serious questionable issues surrounding the legitimacy of the vaccine autism debate. So I can't scientifically say the vaccine doesn't cause autism, considering one of the very researchers in the CDC who is assigned to doing the research, to looking at the association between the MMR vaccine and autism, has now confessed that the CDC ordered him and his fellow co-authors to destroy the data that showed a massive, huge, in fact, is what he said, huge association. Huge. So anyways, but let me go back to that. Put my screen up there real quick. So he says immunogenetic. So a full benefit of increasing understanding of the immunology and immunogenetic, we're going to go back to that, innovative technology to prevent disease through the development of prudent use of vaccines. So I love the fact that he mentioned immunogenetic. So this is just to say I know the research. So as soon as he said that, I was like, awesome. I wonder if he'll be able to explain this study to me. All right? So in this peer-reviewed medical journal right here in front of me, folks, you will find in vivo study of hepatitis B. In vivo, I believe, is in petri dish. In vitro is in an animal. So, in vivo study of hepatitis B vaccine effects on inflammation and metabolism gene expression. So, immunogenetic. So, vaccines have an effect on the immunogenetic expression of people. So here we have it. Right there in front of you on the screen, we have a microarray test showed the expression of 144 genes in the liver was significantly changed after one day of vaccination. So there is immunogenetic effects of vaccines. So if we change the genetic expression of the cells within the liver, will we see those problems, potential problems, of alterations in the inflammatory genetic expression and control pathways? Will we see harms only in the first 5 days after vaccination? Or could we potentially see them much, much later in the life of that individual? I'd love to know the answer of that. And I think that's a constructive question to be asked to a scientific individual. It goes on here. The prudent use of vaccines. There must be methodology and mechanism through which experts and public, including those who are skeptical about vaccines, can engage in civil discussion of vaccine policy or vaccine public policy now and in the future, as recent outbreaks demonstrate the health of a nation depends on it. You know what I would say? The health of our nation depends on a public discussion of this matter, of this information. Because right now in America, our children, over 50%, roughly 1 in 38 children, over 50%, suffer with a chronic medical condition. 1 in 38, according to the latest statistics, is suffering with an autism spectrum disorder, a severe, debilitating, oftentimes disabling mental neurological health problem. 1 in 38. That is far more. Measles didn't harm 1 in 50. Polio didn't harm 1 in 50. Whooping cough didn't harm 1 in 50. Mumps didn't harm 1 in 50. Or rather, 1 in 2. Measles didn't harm 1 in 2. Whooping cough doesn't harm 1 in 2. Again, 1 in 2 children, where before we had the number of vaccines we do today, we were seeing roughly 12%, and that was a time period in which we still saw 1999, I think there was, I don't know how many vaccines. Was there 15, 30? I don't really remember. I don't know. I'd have to go back and look at that exact date. But a time period when we had at least less than 50% of the number of vaccines we use today in America, we saw 1/5 the number of chronic illness in our children. So now we have 1 in 50, or 1 in 2. So we have over 50% of our children suffering a chronic health condition. Sorry guys, the numbers get kind of confusing at this point in time in these talks. So we are literally looking at 1 in 2 children in America suffering from a chronic, lifelong health condition. Again, I will state, measles didn't harm 1 in 2. Whooping cough didn't harm 1 in 2. Polio didn't harm 1 in 2. Mumps didn't harm 1 in 2. Rubella doesn't harm 1 in 2. Diphtheria doesn't harm 1 in 2. Pneumococcal, influenza, HPV, dengue, all these infectious illnesses don't harm 1 in 2 children. All those illnesses would never lead to 1 in 2 children suffering from a lifelong chronic health condition. But somehow, that's where we found ourselves today. And I don't believe it's somehow, because there is no question in my mind that the vaccines are a major contributing factor to that. And there is adequate evidence in scientific studies in the peer-reviewed medical literature to state that right there. Folks, I am praying, and I will let you know if I hear a response from Dr. Gregory Poland of the Mayo Clinic. Hopefully, he won't refuse a public and civil discussion in regards to vaccine safety and effectiveness. I love y'all. Thanks for tuning in. Hopefully, and that's kind of like one of the things when you read that stuff, you're like, I just got to get this off my chest. I really want to kind of talk about this, since I rarely get, we're not even being given a public opportunity to have this discussion on Facebook. We're being censored. Sam says, if there's no way to have a civil discussion, they need to leave us alone and let us make our own choices, Sam says. Tammy, all debates need to be on video. I completely agree. Justin says, can't wait. Exactly. Tammy, And pediatricians tell parents give their children Tylenol after vaccines, which causes mitochondrial dysfunction. The scientific evidence has that. Couple that with the scientific evidence that shows mitochondrial disorders may lead to an increased risk of vaccine neurological injury. Doc, you are the one who knows the research. You need to contact Ben Shapiro, the conservative political commentator. I would love for people, like, if you know this stuff, if you message, we need like you can message us through the website. Don't message us through Facebook. Facebook, we get hundreds to thousands. Every time somebody TWDs, we get a message through Facebook. It comes to a personal message to the Wild Doc Facebook page. So there's no way for us to review all of those hundreds of thousands of comments and questions and responses and messages. You have to go to thewilddoc.com. You have to go to my website, go to the website and say contact, and then you can request a consultation if you're searching for health advice on a personal level, or if you're wanting to help in such a manner as putting me in contact with Shapiro. I would gladly do that. If you know, we don't watch TV, we don't watch this stuff. Like, literally, my children, we go out and pick wild blackberries and make slip and slides out of a 100-foot plastic tarp. Like, that's what we do, you know. Is he?
Yeah.
I would love to talk to him. So Ashley knows who he is. But that's one thing. It's like I'm even trying to do a response for the Hoties and what's the guy? Fighter, commentator guy. Joe Rogan. I would love to go on the Rogan show and have a civil discussion about this. I would love for Hoties to sit there next to me, and me and Hoties have a civil discussion, and we'll have Joe Rogan be the moderator. So if you guys know this, please contact us that way. We can really keep those to professional, just simple questions, comment, assistance. Like Darla, you were asking about assisting there, and I appreciate that, to get me in contact with somebody that may be willing to have a public discussion to this matter. Celeste says, when the next generation comes up with all these diseases, government will not be able to deny the cause. They already are. I mean, I don't see any acceptance of the issue in the near future. Bree Farmer says, have you seen this? How are we supposed to make informed decisions about our health care when the FDA hides the critical safety information from the public? The Food and Drug Administration announced it is shutting down its controversial alternative summary report program and ending its decades-long practice of allowing medical device makers to conceal millions of reports of harm and malfunctions from the general public. As of Thursday, though, the agency said it would leave the textured breast implants linked to a rare lymphoma on the market. Matt Bertich, Denver area biomedical engineer. Looks like I'll check it out. I haven't seen it, but I'll check it out. Taking a picture of the screen right now. If you can send that to them through my website, not through the Wild Doc Facebook page. If you want me to take a look, and I'll try my best. But I do appreciate everybody. I love you all. Please, please, please share the truth. Don't just like it. In just a thought of somebody saying, like, if they won't have a civil discussion with us, to leave us alone. Here's my thoughts on this, and this is me personally. I wish, yes, they would stop attacking our ability and rights, our constitutional rights to say no to a medical intervention for ourselves or our children. If they won't have a public discussion upon it, they should stop attacking and trying to take our rights away and force vaccinate our children, or hurt us financially, or hurt us socially. They should stop all that until they're willing to have a full public discussion with people like myself, Bobby Kennedy, Del Bigtree, and so many others. Andre, Jack, so many people, Suzanne, Polly. I feel like if I don't mention them, there's so many people that could have a legitimate public discussion on this matter, and I wish they would. Or again, I would say stop attacking our rights, but I'll tell you this, I'm never going to leave them alone. Even if they left me alone, I will not leave them alone, because I'm not fighting for my children. Folks, we have got to stop the discussion in the request for our politicians or the medical community to respect our right to say no to vaccines. We have got to change the discussion to there are children. We have epidemic proportions of chronic illnesses in our children. Our children are crying on a daily basis for help. We have children that can't even express themselves verbally, physically, or socially, will never be able to have a marriage, to have children of their own. Potentially, and without a shadow of doubt in my mind, given the available evidence and research that we have, and the times the government bodies like the CDC have had to lie to conceal the association between serious conditions like autism and vaccines, I am fighting for those children and the children to come into this world who will be taken advantage of by the pharmaceutical companies. That's who I'm fighting for. So I will never leave them alone, even if they would leave me alone. Because if their lies ever continue, if their lies persist, if they do not have full disclosure of the information completely, transparently, and truthfully and honestly, like Gregory Poland is stating he would want, then I will continue to fight for our children. Continue to fight to get people the truth. And I'll try my best to do it civilly, if given the opportunity, in the presence of Gregory Poland. And I know he's probably like, yeah, this guy's like prideful, he's pompous, everything like that, but I'm not. I'm very, very serious about wanting to do this. I'm very serious about wanting to have a true discussion on this matter, because I know maybe he doesn't know the information I presented. He may not have read the in vivo study of genetic alterations due to the hepatitis B vaccine that we give to our children on day one. He may not know about that stuff, so I would like to ask him. I would like to have a constructive conversation about that. It has started all about money. It started all about money. Now they've added the fact that they are on a mission. Take the vaccine or I'll make you mission. Passionate for a good reason, Sherry says. I appreciate you all. I gotta go. Love you all. Share the truth. Don't just like it. It's the only way to save lives. Did I get it?